I'm pleased to now introduce Dr. Marty Greer. Dr. Greer is the co-owner of Veterinary Village and the Director of Veterinary Services at Revival Animal Health. Dr. Greer received her DVM in 1981 from Iowa State University, and in 1982, she and her husband, Dr. Dan Griffiths, founded Veterinary Village, where they have developed a reputation for providing high-quality veterinary care along with canine breeding and reproductive services. In 2002, Dr. Greer opened a canine semen freezing center, the International Canine Semen Bank, Wisconsin, and became Penn HIP certified. In 2005, Dr. Greer was appointed by Governor Jim Doyle to a position on the Veterinary Examining Board of the Department of Safety and Professional Services, where she served for 8 years. In 2010, she added the distinction of graduating from Marquette Law School. Dr. Greer is also an author, penning Canine Reproduction and Neonatology, which won the Dog Writers Association of America's DogWise Best Book Award, and the more recent book, Your Pandemic Puppy. Dr. Greer is a trusted advisor to numerous leaders across the breeding and veterinary communities. She serves on the board of directors for the Society for Veterinary Medical Ethics, American Veterinary Medical Law Association, and the Society for Theriogenology. In addition to her veterinary work, Dr. Greer raises and shows Pembroke Welsh Corgis and Danish Swedish farm dogs. Again, please post any questions you have in the chat box during the presentation, and Dr. Greer will answer as many as she can afterwards during the live Q&A. Welcome, Dr. Greer.
So today I'm going to be talking about best practices incorporating canine genetic testing into patient health, planning, and treatment. So this is a pretty great topic on practical application of what we can do with DNA and other genetic testing for patient best health. So I'm Marty Greer, and I'm happy to be here today. So the summary of what I'd like to talk about today will include what breed or breeds is your dog, what disorders do you have in your breed, researching tests and which labs to use, understanding the test and inheritance patterns, what are your dog's genetics, finding a veterinarian, and then developing a treatment plan and a prevention plan. So the first thing we need to talk about is researching what breed or breeds is your dog. I know that sounds obvious to some, but it's actually not as easy as it is. Some purebred dogs from breeders aren't actually purebred dogs. Sometimes there were some accidents that happened in breeding programs. So we do need to make sure that we know exactly what the breed is. Generally, a purebred dog from a breeder is a purebred dog. And in that case, you can pretty heavily rely on your breeder and your breed clubs to help you with breed identification and the associated disorders that we have to be concerned with. The second category of dogs would be, instead of a purpose-bred or purebred dog where you know the breeds, would be a breed of unknown heritage. And in that case, there is a DNA test or DNA tests that can be used what breed or breeds are making up your dog's genetic pattern. Those are pretty interesting tests and really kind of good to have information on. So we'll talk about that. So breed-based testing is very important for a couple of reasons. So why is it important for you to know what breed your dog is? Well, for one thing, you can then know the breed's predispositions for disorders or other reasons to be watching. So it can be helpful to know your dog's breed for prediction of disease processes. From that, you can go to the breed club websites, and even the purpose-bred dogs that may not be purebreds do have breed club websites that have information on them about health, about standards for appearance. So there's some really great information on these breed club websites, whether it's a purebred dog or a purpose-bred dog of other types, or once you find out that your dog may be has the genetic makeup of 2 or 3 or 4 breeds, you can go to those breed club websites and start to ascertain information on what you should know. The CHIC website is also a great website that's part of the OFA website. It stands for Canine Health Information Center, and that has a whole listing of all the breed clubs and the breed recommendations from those breed clubs for what kind of DNA and genetic testing should be accomplished for your breed. So there's really great information on there. It also helps if you're networking with other people. So if you're looking for information, networking with breeders, networking with other people in your breed. Great information can be developed from that. The other thing that's nice to know is if you don't have a DNA test for a specific disorder, or even a genetic test, which we'll talk about, there's phenotype and genotype testing, then you can go ahead and keep monitoring for those diseases, such as thyroid disease, such as hemangiosarcoma, which is a tumor of the spleen that we frequently see in a lot of different breeds, particularly large breed dogs, and then things like pyometra. So we're going to get into a little bit more of that as we go. But if there's not a DNA test for a disorder or an OFA test for a disorder, then it gives you the opportunity to know what kind of things you should be monitoring your pet's health for, so that you can have early detection, and early detection is always going to give you a better chance of better management of that disease. So the second question is, what disorders are in your breed? In certain breeds, we know that there are specific disorders. So again, this is going to be more research. So important that we're aware of the disorders, and there are, as we've listed on the last web page, our last page, there are a lot of information there's a lot of information out there on websites. The important thing to know is new mutations occur, but they're pretty rare. So it's unlikely that you're going to see a new mutation in your breed, but if you do suspect something, there are labs that are going to be willing to help work for those things. Breed club websites and chick website, like I said, are really helpful. The DNA testing labs also have an incredible wealth of information on their websites for information that you want to get out there and take a look at and see what kind of DNA tests are available. In preparing for this presentation, I was on the website for Embark, and there's just a wealth of information out there, just amazing number of DNA tests that are available to us, that some of them I wasn't even aware of because they're coming out so rapidly and so significantly that it can be difficult to keep up with everything. And then breeders, well, breeders can be a great source of information, but sometimes breeders aren't the best at sharing information. Sometimes you have to have a real heart-to-heart talk with them before they'll be willing to share information about their lines. If they are willing to share, many times you can take that information back to your veterinarian and have information about that particular line of dogs or that particular breed of dogs that can be immensely helpful in determining what kind of a disorder you have in your dog. So if you have a dog with an unusual symptom or an unusual set of disorders, then a lot of times the breeders have seen that before. So please be sure to resource the breeder that you've gotten your dog from and other breeders in your breed or breeds to see if they can help you determine what kind of a disorder that you have, because there are some really great resources out there if they're willing to share and talk to you. Next are which tests are available. So again, it's more research. So what disorders happen in your breed? And again, going back to your breeder great and your breed website, chick website, I can't overemphasize how much wealth of information is on these websites. I will say that you need to be a little bit careful with some panels. There's a lot of great panels out there that give you a number of tests, but the tricky part is to know which disorders are actually important in your breed, because some of the panels are casting a wide net and they're fantastic pieces of information, a lot of great information out there, but sometimes they pick up disorders that have never been reported in your dog's breed. So again, you don't want to overinterpret, but you also don't want to underinterpret. So that's where you can get on the phone with the people at the DNA labs or do emails with the DNA labs, talk to other people in your breed and see what kind of information you can obtain. Included in that is phenotype testing, which we'll talk about. And then, of course, is the ability to trust the lab that you're working with, that they are accurate in their testing, that they're accurate in the dog that they're identifying. So there's a lot of things that can really be important when you're talking about those trust factors that go on with different laboratories. There's very little government oversight at this point in labs, so you have to be really careful that you're picking a lab that you feel is trustworthy in their data and in their sample handling. So researching, again, I mentioned a little bit ago, phenotype versus genotype. So phenotype is the appearance or a function test. That's going to be things like OFA x-rays of the hips, the shoulder, the elbow, the stifle, the hock, looking for OCD. It's going to include tracheal size for certain breeds. It's going to include vertebrae for certain breeds. It'll include eye exams, thyroid testing, bile acids, which is a function test. Um, so there's a multitude of phenotype tests out there. Eye exams are a really important piece of that. And then there's genotype or DNA testing. So those two go hand in hand in trying to determine what the dog's genetic makeup is. We don't have a DNA test for every disorder that we have a phenotype test for, and we don't have a phenotype test for every disorder we have a genotype test for. So those two go hand in hand. One is not replacing the other. For instance, an eye exam, the ophthalmologist will look for hundreds of different disorders, from retinal disorders to lens disorders to pupillary disorders, to corneal disorders to eyelid and eye shape disorders. All kinds of things happen on an eye exam, and there's only a tiny little handful that we have DNA tests for eyes right now. Now, that doesn't mean it's always going to be that way, but there are so many disorders that we don't have a DNA test for that we can find phenotype tests for, that it's important that you don't use one versus the other. They really need to be used mutually in whether it's a breeding program or in assessing your pet's individual health. So very important that we do those hand in hand. So phenotype versus genotype, like I said, neither one is better than the other. There's no DNA test for hip dysplasia. We think there's probably as many as 14 genes plus environment that play a role in the development of hip dysplasia. So you can see hip dysplasia on an OFA x-ray or a pen hip x-ray, but there's not a DNA test. And there's no indication that we'll have one anytime soon because of the complexity of this disease. Eyes, like I said, there's no test for everything that an ophthalmologist can see, but there are things that the DNA test can pick up, such as PRA, progressive retinal atrophy, that won't happen until the dog is an elderly dog. The ophthalmologist won't see until the dog is 12 years old, but the DNA test can be predictive. And then things like cancer, there are no tests for most of the kinds of cancer that we see yet, but there are going to be tests coming, and there'll be things like lymphosarcoma and hemangiosarcoma tests that will be absolutely critical in changing breeding programs. It'll be a total game changer, but it'll also help to predict what kind of disorders you should be watching your pet for as they age, so that you can have early detection and early diagnosis and early treatment. So test interpretation, that gets to be really interesting as well. So the first thing that you have to know is there is no perfect dog. Even this dog in this picture that looks like he might be perfect is a white boxer, and of course that's not the perfect boxer. So what do we do with test interpretation? And this can be really challenging, especially for people that don't have a strong science background, is to understand how to interpret the tests. So there's different kinds of inheritance patterns for DNA. There's autosomal dominant, which most of the time we don't need to test for because those are things that you can visually see with the pet. Autosomal recessive would be something that is on the Punnett square, the big B, little b, and then the big B, little b. So the two little b's make an autosomal recessive. So that's how you would interpret those, is knowing that you how to interpret that and how to use carriers in a breeding program. Because if you have a carrier of an autosomal recessive disease, it can be still used in a breeding program if you're breeding to a dog that's a clear dog. So two big B's with one big B and little b crossed will give you all normal dogs. So you can absolutely use a carrier dog in a breeding program. And in fact, I strongly encourage people to do that, because if we don't in a breeding program, we're going to end up losing a lot of genetic diversity. There's also incomplete dominance, which is another way that genes are inherited. There's linkage tests, which tell us that we're close to the right DNA marker, but not exactly. So again, you need to really understand this. And then back to phenotype again, that those are all things that are super important that we collect in assessing our pet's health in our breeding programs. So the other things that I think are important are, how serious is the disorder that you're talking about? And there is no perfect dog. Every dog has something wrong with it. Every human has something wrong with them. Humans are the most outcrossed species on the planet, and unfortunately we still have genetic disorders in people because it still happens. So I think it's important when you're talking to a breeder about obtaining a pet, or you're talking to a breeder about how they did their breeding program, that you can assess how serious the disorder is. In my world, I calculate things on a tier of 1, 2, and 3. In my world, tier 1 is something like an extra eyelash. Yes, technically that's a genetic disorder. Technically that's something you shouldn't include in a breeding program, but it's a pretty non-serious disorder. It can be easily corrected. It's not difficult for the dog to live with. So I don't have big issues with those dogs being sold as pets or being used in a breeding program. Tier 2 for me are things that require chronic management, like thyroid disease and allergies. It's something that costs money. It takes an ongoing type of management. But again, it's not life-threatening. It's not life-changing, but it does require chronic management. For me, tier 3 are things that are a lot harder for me to think that somebody may want to take a puppy as a pet that has those kind of disorders or used in a breeding program. So that would be seizures, that would be bad temperament, that would be serious orthopedic disorders, things that are life-threatening, life-altering, life-shortening. So I think we have to really look hard at how serious the disorder is when we're trying to understand the tests and how to apply them to our pet's health. So now we finally get to your dog's genetics. Finally, after we've done all this other research, we've gotten to that point. So in this case, again, we've talked about the phenotype versus the genotype. So you can do the hips, elbows, shoulders, hearts, and eyes. You can do spine. You can do trachea. Bear testing is to assess for hearing. Bile acid, like I said, is a function test for liver. We see PenHip and OFA for hips. We see blood testing for thyroid. And then, of course, we have structure. We have the head type. We have the angulation, the top line of the dog, the general appearance of the dog. Those are all important from a perspective of not only function and health, but for breeding as well. So when we're talking about breeding dogs, we aren't just worried about their structure from the perspective of putting out a beautiful show dog, but we want our dogs to be functionally, structurally correct. A lot of people misinterpret conformation dog shows as being a beauty contest for dogs, and in reality, it's to try and establish whether a dog meets the structure, meets the criteria for that dog's type in the breed ring, because structure and function go together. So we need to have dogs that are put together correctly so that they can continue to hold up in agility or hunting or just hanging around on the couch with the family. If our dogs aren't put together correctly, if their bite isn't right, they're uncomfortable, if their legs aren't angulated correctly, if they're not put together correctly, those dogs have a lot of structural issues that can cause them pain and discomfort as they age. So I think structure is very difficult because there isn't going to be a DNA test for anything anytime soon. So it's really important that we know that information. Then we need to find a great veterinarian. And this, of course, is a very important role. The other enjoy working with and that works out well. So not every veterinarian is going to know every single thing about every single breed. In fact, there are new breeds coming all the time, and it's very difficult for veterinarians to know every breed. So don't expect your vet to know a breed that might be an unusual one. I have Danish Swedish farm dogs, so it takes a little education to understand those breeds. Not every veterinarian can know every disorder in every breed. DNA tests are coming out hard and fast. That's awesome. It's terrific. But again, veterinarians aren't going to be expected to know every disorder. So if you go in to talk to your veterinarian about your breed or a disorder, make sure that you give them an opportunity to do some self-education so that they can discuss this with you well. You may need to work with a geneticist to try and determine some of these disorders and how you need to work through those. And you also need to find a veterinarian that's willing to work with you as a pet owner and or a breeder. So there are all types of veterinarians out there. There's all types of clients out there. Not every client and not every veterinarian mesh together. So sometimes you have to find a veterinarian. It might be a little bit further from your home, but sometimes finding the right veterinarian that clicks with your needs can be a very useful established relationship. So what don't we know about DNA testing? So there are disorders that we don't have tests for yet, things like seizures, things like all the eye disorders, things like temperament. There's multitudes of disorders and conditions that we don't have a DNA test for. And in fact, sometimes we may never have one. Down the road, it may be very difficult to develop those tests. But the other thing that's important is that there may be disorders that eventually turn out to be genetic that we currently don't think of as being genetic. There was an article published, and so I have the link in here if you want to look it up. It's called Breed Variations in the Incidence of Pyometra and Mammary Tumors in Swedish Dogs. Now, they use the Swedish dogs because those dogs primarily have insurance. Far more dogs in the European countries have insurance than the dogs in the United States. And many of those dogs are intact, meaning that they're not spayed or neutered. So they're looking at pyometra, which is an infection of the uterus, and they're looking at mammary tumors, which is breast cancer, always more prevalent in dogs that aren't spayed young than dogs that are. So this article was really interesting in establishing that pyometra has a genetic basis, because most veterinarians and most owners don't think of pyometra as being genetic. They think of it as being an infectious disease, something that bacteria get up into the uterus at a certain hormonal status of the female, and it turns into an infected pyometra. But if there's a breed predisposition, and there clearly is, because Bernese Mountain Dogs are number one on the list at 46% of them ending up with pyometra without if they're not spayed when they're younger, it's a huge relationship between that breed and pyometra. In the top 5 dogs on the list of pyometra incidents, 4 of them are giant breed dogs from the northern European countries, including Rottweilers, Leonbergers, and Great Danes. So if you're thinking that pyometra and other disorders are purely infectious, I think you need to kind of reset that and take another look. Other things are like parvovirus. Is parvovirus a genetic disease, or is it an infectious disease? Well, of course it's a virus, but there are breeds of dogs that are predisposed to having parvovirus. So genetically, they don't build immunity to parvo the way other breeds do. Lyme disease, another disease that we think of as being infectious, spread by ticks, but we think there's probably a genetic basis to the incidence of that. And then cruciate ruptures, again, we think of that as being an injury, but in reality, it may not be. Sorry, I have to drink. I usually do these straight on through without any hang-ups. I'm sorry, Brett.
No worries at all. I made a note where we'll cut this out on slide 22, and then you can go ahead and start whenever you're ready, okay?
Okay. So once you know what breed of dog you have and what disorders they are predisposed to, you can look at finding a prevention and finding a treatment. So we're going to look at environment, diagnostics, nutrition and supplements, medications, exercise and activity, spay and neuter, and other interventions. So environment is going to include things like flooring, good footing under the footing of the dogs, booties on their feet if they have a tendency to have orthopedic disorders, to cut down on their incidence of injury. We're going to look at flooring being impermeable if we have a dog that may have a disorder that causes excessive urination. We're going to look at stairs and steps if we have dogs that have orthopedic disorders, to try and keep them from having too much stress on their joints. If we have dogs with visual disorders that might be upcoming, we can look at good lighting, not rearranging the furniture so that they get confused. When you put up the Christmas tree, making sure that you teach the dog where the tree is and don't leave the boxes sitting out when you're decorating. There's lots of little things environmentally that we can do to help our pets to have a better lifestyle if they have orthopedic, hearing, visual, any other kind of disorders. Second would be diagnostics to verify the condition. So along with the DNA tests and the phenotype tests, we now know which disorders our pets might be predisposed to, so we can do more frequent blood work looking for indications of health conditions like thyroid disease, kidney disease, liver disease, Lyme disease. There's a lot of things we can do with blood work. Urine testing, again, checking for signs of transitional cell carcinomas if we have Scotties and Westies. We can look at testing for evidence of diabetes. X-rays and ultrasound, great way to image, and then of course advanced imaging for CTs and MRIs. So if we have a dog predisposed to heart disease, we might want to take chest X-rays on an annual or biannual basis. If we have a dog that may have a predisposition to hemangiosarcoma, a tumor in the spleen, we might want to schedule routine ultrasounds, checking it for any evidence of, say, any changes in the spleen. So there's a lot of things that we can do once we have the idea that a pet might have a condition to verify that we're finding early detection. Nutrition and supplements are very important as well. So weight management, I think, needs to be seriously considered, and dietary influences are important on that. How much you feed, what kind of food is very important if we have dogs that might have a tendency to be underweight or overweight. Vitamins, glucosamine, and joint protectants, again, really great for protecting joints, reducing the risk of certain diseases. That's great. Special diets, if we have a breed of dog that's predisposed to bladder stones, or a dog that has aging changes in their brain, If we have a dog with allergies, there's prescription diets on the market that are out there that are very useful in managing disorders and trying to reduce the impact of those disorders in our pet's health. And of course, there's other things as well, just depending on what your veterinarian and you decide that you need to work on. Medications, if we have patients with arthritis, with hip dysplasia, with OCD, with torn cruciates in the knees, there's lots of great medications along with glucosamine and diet that we can do to manage their pain. Thyroid replacement, of course, is an easy supplement if we have a dog with thyroid disease. Allergy medications, we've got new medications on the market all the time that really have improved allergy management, and there were probably going to be more coming. Other hormone replacement therapy, there's actually a protocol for testosterone replacement therapy for aging female and male dogs that might have testosterone deficiencies, causing them to have mobility issues. So there's a lot of information out there. Exercise, activity, physical therapy, and physical condition all fall together in the same category. Having a dog that's well exercised and fit, very important for their general health. Activity, of course, is important to make sure that they stay fit. Physical therapy, you can come up with finding a physical therapist or a veterinarian that's interested in that, helping you with specific physical therapy that you can do to reduce the impact of certain diseases on your pet's orthopedic conditions. And again, physical condition kind of falls into weight management as well. There's also chiropractic, laser, acupuncture. There's a lot of alternatives that you can use to help manage dogs with disorders of the joints, of the spine, of other disorders. And then intervertebral disc disease, IVVD. I love this picture of little dachshund. Teaching these long-backed dogs to sit up improves their core strength and actually reduces the risk that they're going to end up with disc disease. So it's a little hard to imagine that it's a good thing for your little dachshund or your long-backed corgi or whatever other breed you might have. But this kind of activity established with your veterinarian's input can be very helpful in reducing the impact of diseases. Then spaying and neutering. Topic that's a little bit foreign to some people and not so much to others, but we know that the age of spaying and neutering does impact the development of certain diseases. There's increasing and mounting information out there from Benjamin and Lynn Hart, from David Waters, from other organizations that are looking at how the impact of removing hormones at an early age have impacted a lot of different kinds of health conditions in our dogs. So we know cruciate ruptures are more likely to happen in dogs that are spayed or neutered young. In golden retrievers, it's 4 times the incidence of a cruciate rupture in a spayed or neutered young dog than it is in a dog that's left intact with their hormones. So it's important to know that. We see less hip dysplasia in dogs that are spayed and neutered older. We see less thyroid disease, less allergies, less obesity, less urinary incontinence. Up to 20% of female dogs develop urinary incontinence if they're spayed young, and by waiting we can reduce that. We also see less cancer in certain types of cancer. We see less lymphosarcoma, which is lymph node cancer. We see less hemangiosarcoma, which is spleen cancer, less mast cell tumors, which is a skin tumor, and there's less osteosarcoma, which are bone tumors. So if you have breeds of dogs that have a genetic tendency to have those kinds of cancers, waiting to spay and neuter can be very valuable in reducing the incidence of those diseases, especially in cancer, things that are hard to manage, hard to diagnose, and hard to get under control because there aren't good treatments for it. The other things, of course, to consider for spaying and neutering are to prevent or cure a health condition. So a retained testicle, that should be removed because that eventually, as the dog gets older, be putting that dog at risk of tumors in the testicle because the abdominal testicle is going to be too warm, and then we're likely to develop cancer in that. There's also persistent Mullerian duct syndrome, and that's a pretty rare condition, but it is an abnormality in the male's reproductive tract. There is a DNA test for that, and those dogs are predisposed, again, to a retained testicle, increased risk of tumor in the testicle, increased risk of torsion in the testicle, and in fact, there are rare cases where this persistent Mullerian duct syndrome can lead to a male dog having a pyometra. So it's kind of hard to wrap your head around that, but it's important to know that a retained testicle is not just a retained testicle, there's other aspects to it as well. And then we have patellar luxation. We also believe that delaying spaying and neutering reduces the risk of patellar luxation, and correcting that patellar luxation surgically may reduce the risk of cruciate ruptures. Other treatments were going to be things like distichia and entropia, and those are eyelid disorders. Distichia are extra eyelashes around the edge of the eyelid. Entropia is when the eyelid rolls in, surgically correctable. So if you have a dog with those disorders, you should be talking to your veterinarian about that. Like I said, retained testicles, those should be removed. They don't have to be removed when those dogs are puppies. They're not going to be at increased risk of a tumor in that testicle until they become aging. But still, you don't want that dog going into late adulthood with a retained testicle in the abdomen. Umbilical and inguinal hernias, those should be corrected surgically. Things as extensive as hip replacement can really change a dog's lifestyle. So there's a lot of treatments out there depending on what disorders your dogs have. Then I want to briefly mention panels of testing. So the first thing to know is there are multiple kinds of DNA tests out there. So there's not just one DNA test. Embark has tests on breed and health kits so that they can do both the breed and the breed-associated disorders. They have a test to check for purebred dogs. There's a breed identification test so that you can find out what breeds went into the genetic development of your dog. There's the health screening test, the genetic health testing, that tell us if the dog's at risk of certain genetic disorders. There are trait tests to tell us what size the dog is, how long their tail is going to be, what kind of coat they're going to have. So there's some pretty interesting trait tests out there. And then there are also parentage tests to establish that the father and the mother that have been represented to be the dog's parents are actually those dog's parents. So again, there's lots of different kinds of DNA tests. And the tricky part to this as a pet owner is to figure out which one applies to your pet so that you're ordering the right test and getting the right information when you interpret the test on how to use that information for your pet's health. So I'm going to go through a few disorders just to explain some of these, and then we can wrap it up. So MDR1, there's a test for that. There are 3 levels of genetic markers in that. It's a codominant test. So you can have a dog that's normal. You can have a dog that's heterozygote, which means it's a normal/mutant. Those dogs are still at risk of certain drug uses. And then there's the mutant. So there are 3 results that come back from that test. That tells you that there are particular drugs that should be avoided if you have a dog with this MDR1 marker. The drugs to avoid are going to be the heartworm medications, which will be ivermectin, selamectin, milbemycin, and moxidectin, which are all heartworm preventives. But at the therapeutic dose for heartworm prevention, they're safe in almost every dog. At higher doses to use for other treatment besides heartworm prevention, you can run into toxicities. Imodium, acepromazine, butorphanol, certain chemotherapeutic agents, and apomorphine all need to be managed differently in MDR positive dogs that do have MDR abnormalities. So if you have a dog with these, your veterinarian should know that so that they can manage the drugs and manage the doses of the drugs that they're administering to your pet. IVVD is intervertebral disc disease. Again, there's a lot of information on the website about this. We see a wide variety of disorder in this, but some breeds like Beagles and Cocker Spaniels, even though they have the DNA marker, they don't tend to see the incidence of the disease that we see in other breeds. So they may not be as affected by it, but again, it's good to know if you have a dog at risk for intervertebral disc disease. You can manage their weight, you can manage their physical fitness. There's things that you can do to make sure that you reduce the risk of your dog slipping a disc and ending up with disorders of the back, causing severe issues with the back and as far as inability to walk, paralysis. Blood clotting disorders, there's von Willebrand's disease, there's a type 3 that we see in Scottish Terriers. So again, if you're testing for different blood clotting disorders, make sure you know the right test to run for your breed so that you're ordering the correct test. Thyroid disease, we can see predictive changes on thyroid panels that are useful in knowing ahead of time if you have a dog that's at risk of developing low thyroid. The question that we don't have answered right now very well in veterinary medicine is, do different breeds have different normals? So for instance, is a golden retriever's normal thyroid level going to be different than a Samoyed's normal thyroid level? So there's information that we don't fully understand about some of these things, but great to have information knowing if you have a dog at risk of developing thyroid disease so that when they're younger, you can diagnose this earlier. Then there's this really interesting condition that we see mostly in retrievers, labs, and Goldens called ichthyosis. Ichthyosis really means fish skin, and basically this is just a disorder of the skin where there's a lot of extra flaking and a little bit of oiliness to the coat. There's no cure for this. There's no serious disease that goes with this. But if you have a dog of those breeds, or sometimes breeds that are combined with those, and they have a really flaky, dry coat, you may save yourself a lot of money not running veterinarian to veterinarian, running around trying to figure out how to treat this, how to cure this, knowing in advance that this is a non-curable but not life-threatening disease is really great information to have so that you're not spending time and money on things that aren't really helpful to you. Vision disorders, like I said before, DNA testing does not replace eye exams, but if you have a dog with a predisposition to having vision loss over the time of their life, you want to make sure that they're in an environment with good lighting. You want to avoid stairs. If you do have to have stairs that go up and down, for instance, on your deck in the dark at night, when they have to go outside, you can put lights on the deck steps so that they can see where they're going. Avoid rearranging their life so that they run into furniture, run into things that happen. So there's a lot of vision disorders that you can really help manage the pet's life quality with managing their environment. So resources that I want to give you today before we leave is Gerald Bell, Fran Smith, and Larry Tilley have an amazing book on genetic disorders in the dog and cat. It's a green covered book put up by Teton New Media. So if you're looking for a really comprehensive resource, that's great. Like I said, the breed websites and the chick website are excellent resources. Genetic lab websites are super. And then there's one website called dogwellnet.com. It's the Dog Harmonization Project. It was started, it's primarily a European group with some North American content as well. But this is an organization that's intending to improve standardization of and access to genetic testing. So I'm on the board for this, just as a disclaimer on this, but there is a great resource there for dogwellnet.com if you're trying to understand what tests are useful and effective for your breed or breeds of dogs. So in summary, I just want to say that number one, there is no perfect dog. Two, breeders don't genetically breed dogs with disorders. If a disorder happens in their dog, it's because they had a likelihood of a carrier that was bred to another carrier that they weren't aware of. So breeders don't get up in the morning and say, I'm going to breed a dog with a genetic defect. Those are just, unfortunately, things that happen. Carriers should be used in a breeding program. If we throw out all of our carriers for all of our genetic diseases, we're going to end up narrowing our gene pools to the point of danger to our breeds. So we should be using carriers with the right information. Number four is find a breeder, an expert, and a laboratory that you trust. So make sure that you develop a network of people that you can really count on when you're trying to determine what kind of genetic tests are useful and how to manage those. Number five is communicate appropriately and honestly. So if you have a situation with a disorder in your pet and you contact the breeder, be nice, be polite, contact them directly. Don't bash them on Facebook. Don't bash them in other formats. Communicate with them honestly and appropriately because they did not set out to breed a dog that had a disorder. Number six is if you have a dog with a disorder, whether they survive or don't survive it, get an actual diagnosis. Don't just say, well, I think it was something bad. Try to get an actual answer because that's really important for the genetics of that a line of dogs and the genetics of the breed as a whole. I will say that the Bernese Mountain Dog people with Berner Guard have the most robust database of any breed that I'm aware of. So there's a lot of great information that comes from that, and that allows the Bernese Mountain Dog people to make better genetic decisions in breeding. And number seven is in the giant jelly bean jar of genetics, you can get all kinds of interesting combinations of things, of genetics. So we don't always have the ability to predict absolutely everything that's going to happen. Number eight is if you're trying to run a breeding program and you have genetic disorders, which every breed does have, select away from serious diseases first. So take your tier 3 diseases that are life-threatening, life-altering, life-shortening, and get rid of those first. Number 9 is mutations happen. They're rare, but they do happen, and so every now and then there'll be something new that shows up. And number 10 is find a great veterinarian, work collaboratively with them and let them know you appreciate them. Make sure that their staff, everybody on their team gets treated well, because veterinarians count on their entire team to make sure that they can provide the best care for you. So be sure that you are finding a veterinarian that meets your needs and that you can work with well with a full team of people that are really important, because that is the other family doctor in your life. So I want to thank everybody for coming and joining us. I hope that this was important information and helpful to you. So thanks for having me.
All right, and we are now live for our Q&A session with Dr. Marty Greer. Thank you very much for that informative presentation and for being here today as part of the Canine Health Summit.
Thanks for having me. I appreciate being here.
Terrific. So we've had a number of questions come in, and I'm sure they'll keep coming. We certainly won't have time to get to all of them. So as I've been sharing earlier in the conference, all attendees are welcome to post your questions over in the Embark booth, and there's a number of technical and scientific experts there who may be able to answer some of the ones we don't get to. But for right now, why don't we just jump right in? We only have 5 or 6 minutes here. We'll go a little bit past 2 Eastern. But first question I see, how do you balance the severity of the disorder, the potential phenotypic effect, against the frequency of the actual phenotype of the disease engaged in a given trait as tier 1 to 3?
Yeah, and to me, I would pick 10 dogs with minor defects all day long before I would pick one dog with a serious defect. And to me, serious defects are inherited epilepsy or seizures, life-threatening, life-altering, life-shortening, debilitating diseases like severe hip dysplasia, elbow dysplasia, bone cancer. Bad temperament to me is really important in that. And unfortunately, we see an increasing number of dogs that are having difficulty with fear and anxiety and temperament issues, creating bites and hazards that go with that. So I'd rather see 10 umbilical hernias that are no big deal, easy to fix, not a serious problem, doesn't change the dog's lifestyle or life expectancy, rather than I'd see one seizuring dog. So now every breeder has their own issues, every breed has their own issues, every person has their own scoring system. So this is really an artificial scoring system 1 through 3. I don't know that anybody else has adopted it, but it just made it easier for me to try and explain to people how they need to look at things, because when you take an 8-week-old puppy into the veterinary clinic and they say, oh, he's got a retained testicle, or she's got an umbilical hernia, or she's got an extra eyelash, a dysthekia, those are really easy to throw out of the gene pool when they're 8 weeks old because they have this genetic defect. But then we get to the dogs that are 3, 4, 5 years old, that are crippled, that are seizing, that are having terrible health problems. They may have already been bred because you didn't know it was going to happen. You're going to have that dog for the rest of their life to live with all those medical expenses and disorders that go with it. So the problem is, how do you pick the right puppy when it's 8 weeks old, when we don't have a DNA test for absolutely everything that's going to happen? And I don't know that we'll ever have a DNA test for everything, but boy, things have come along a really long way in just a few short years. So it's very exciting to see those changes.
Yeah, that's great. And like you're saying, I think, ultimately that's the goal of a lot of these questions is, how do I work towards healthy breeding programs and healthy puppies? And as you're saying, there's a lot of different factors to go into it. There's a follow-up to the same topic, which is, how do you factor in the unknowns about potentially beneficial traits that might be linked to disadvantageous traits?
Yeah, and really, the best thing you can do is just the best thing you can do. Breeders don't get up in the morning and say, I'm going to breed a dog that's sick or has a genetic disease. So all you can do is the best you can with the information we have at the time. The one thing that we talked about briefly on a slide was the incidence of pyometra, parvovirus, things that we thought were viral or bacterial diseases. Lyme disease, do Bernese Mountain Dogs have more Lyme disease than some other breed? And the answer to that is there probably are breed variations. So all you can do is the best you can, but you've got to be really careful. This is my lawyer hat going on. You've got to be really careful with what you guarantee in your contracts, because what we don't think now are genetic inherited diseases are probably going to turn out to be that way. If you look at the list of genetic diseases that Embark has on their website, it is mind-boggling how many are there. And it just illustrates that things that we didn't know 2 years ago, 5 years ago, 10 years ago were genetic. So in the lifetime of your dog that you're selling as a pet puppy to the general public, 10 years out, when that dog is 10 years old, what are they going to find that was genetic? And now you said in your contract, you guaranteed against genetic diseases. For how long? What does that mean? Which diseases? You know, if you're writing a contract and selling a pet puppy or a breeding puppy, you need to make sure that your attorney does a really good job of wording those that language so that you don't end up replacing dogs 10 years out that you had no expectation of having a problem at the time that you sold them.
Got it. Got it. Well, thank you for that. There's a question about copper storage disease, which we'll skip on for now because there's a focused presentation tomorrow on that very topic by Dr. Hilly Featon. So tune in tomorrow to learn more about copper storage. There's a couple questions about spaying and neutering and I think timing. Like this one says, what age do you recommend to maximize the health benefits for
Right.
spay and neuter?
Right, and then there's health benefits, there's cancer, there's behavior. Again, there's a whole array of things that we're just starting to scratch the surface on. And really, since the 1970s, it's been the norm to spay and neuter anything that wasn't going to be used in a breeding program. And people that didn't do that were looked on unfavorably, and still to this day, pretty unfavorably by a lot of veterinarians. And I think that that revolution is starting, and we really need to take a look at the importance of leaving our dogs hormonally intact. Michelle Kutzler has information about how that influences the development of lymphoma. Osteosarcomas are involved in that, mast cell tumors, hemangiosarcomas. So things, again, that we didn't really think about being related to spaying and neutering are probably going to turn out to be that way. So we don't have a magic age right now. I can't point to any one person's research or data to say that 4 years old or 6 years old or whatever it happens to be is the magical age. But I think you need to look at Benjamin Hart's work on different breeds because large breed dogs we know have a greater incidence of certain diseases compared to small breed dogs. So spaying and neutering the small breed dogs may be more appropriate than a large breed dog. If you look at some of his information like the Golden Retriever data, and that some of this is probably also going to come from the Morris Animal Foundation, their Golden Retriever Lifetime Study. And we've got about 15 dogs in the practice that are involved in that. So we're really proud of that data that we are able to contribute to Morris. But as you look at that, we're going to see that there's a big difference. Golden Retrievers have 4 times the incidence of ruptured cruciate ligaments than dogs that are left, if they're intact, they're 4 times less likely than dogs that are spayed or neutered. And frankly, there's a lot of veterinarians that make a very, very nice living charging $5,000 a knee, $10,000 a dog to fix cruciates, when in reality, if we waited to spay and neuter, or if we left ovaries and testicles and did either a vasectomy or an ovary-sparing spay, we might be able to save huge amounts of money and save our dogs from difficult and painful recoveries and accidents. Every day I talk to people that are doing performance work, agility, flyball, a number of things that you don't have to have an intact dog for, but they're looking at leaving testicles and ovaries just to reduce the risk of hip dysplasia, torn cruciates, and other orthopedic diseases, obesity, and it goes right down the list. There's a question that follows this about behavior with fearful behavior and anxiety potentially being linked to spaying and neutering as well. And we've always been historically taught that dogs that are spayed or neutered are less aggressive, less likely to be in fights, less likely to have these behavioral issues. And Christine Zink and some of her colleagues have shown that that may not be the case as well. So take a look at Benjamin Hart's data. He's got it broken down by about 35 different breeds right now. And that's going to give you a lot of information based on what breed you have. There's also the link in the presentation about mammary tumors and pyometras from the Swedish study. So again, take a look at your breed, do some research on that, and make sure that you really have a good understanding of what the impact of all these different things are before you make life-changing decisions like removing testicles or removing ovaries, because your veterinary clinic is going to pressure you to do that, but it may not be appropriate.
Got it. Well, you are clearly a wealth of knowledge. We could, I think, spend the rest of the day talking about these topics. So we're technically over time, so need to wrap up here. As I mentioned, some of these questions that we didn't get a chance to answer, we hope to do so across other forums in the event. Dr. Greer, just as a parting note for those who are still with us here, Do you have a kind of a call to action or a key message you want to leave people with as we wrap up?
I think the bottom line is the more we know, the less we know. So don't be too certain in the things that you say, the things you write in your contracts, the decisions you make about spaying and neutering. Be open-minded and continue to learn, because there's going to be more and more information coming all the time.
Got it. Got it. Well, thank you again so much for your presentation. It was highly informative, and as you mentioned, there's lots of links and references in it. So thank you again for that, and for all of our viewers who are on. If you go back to the lobby, the next presentation has just started a few minutes ago by Embark's Chief Science Officer, Dr. Adam Boyko. So you can feel free to switch over to that, and thank you again for being here for this session.